Good afternoon. Thanks for tuning in today. My name is Jeff McKay from Brightsquid. With me today, as usual, is Mark Ayre. Mark, how are you?
Hey, good afternoon, everybody. Thanks for coming.
So today we're going to talk about screening and recall that clinics are doing through Brightsquid now. We'll talk about some of the things that people are doing to screen and how they're doing that a little bit. And we've got a little pilot project that we've been working on that we'll talk about some of the stats and show you how screening works in getting patients into your clinic or re-engaging them. We're going to talk about how that can make improvements to the healthcare system as a whole. So screening is a proactive care measure. It contributes to improved outcomes, and it can help optimize the value of every appointment. And we'll talk about how that works. Recall is really about patient attachment and eliminating some of the cracks in the system. And like I said, we'll talk about screening in action, show you what happens when clinics are sending out screening messages or forms to patients through Brightsquid and SecureMail. So first of all, improvements to the system. We're talking about proactive care versus passive care. Instead of waiting for patients to come when they have aches or pains, we're reaching out. How are you feeling? Do you have any of this? So that we can address issues in advance. What we've seen since COVID, specifically and especially, is that patients have developed a habit of avoiding care, and they don't call to get checkups. They're not getting screened for things they should be on a regular basis. So screening is down, and when that happens, outcomes go down, because when someone shows up and they're further along than they should have been when we would have screened them ideally, their outcomes may be worse, complications increase, costs go up, that sort of thing. So what we've seen across the system, across the spectrum of care, the research really indicates that information systems that make it easier for clinicians to work together with patients help improve overall health outcomes. We're talking about patient satisfaction, patient outcomes, cost to the system, and also provider satisfaction, because what happens is, as a provider now, I'm able to be more impactful. I'm doing better work. And having that impact that I set out to do when I launched into this career. Patient engagement in care outside of appointments. We tend to see patients in a very hurried fashion sometimes when we're seeing them in an appointment, and this helps you engage with your patients over the long term. It's a continuity of care tool, as well as we'll talk about, a business tool. So screening, I talked about proactive care versus passive care, and Mark, you talk to patients and clinics every day. What are they saying about screening maneuvers, things that they're doing, and the impact that has on their practice?
Well, Jeff, when we launched the SecureMail service, however many years ago it was, we as software developers didn't really know exactly what clinicians are going to do with it. We knew that there was a need to communicate. We'd heard that desire from clinicians, but it wasn't until we'd seen our users send literally millions and millions of messages that we started to see these patterns evolve. And we started talking to these clinicians saying, what kinds of things are you doing? What sort of traffic, what sort of use of SecureMail are you finding to be most impactful, to use your word from the earlier slide? And these are the kinds of things that are now coming to bear more and more, with tens of thousands of messages going through our system every day. These are the things that we're seeing. And screening is one of the most important, most valuable things that our clinicians are doing, because it's allowing them to stay in touch with their patients and identify problems before they become a capital P problem, to coin a phrase.
Along that point, right? Patients may not know that they're experiencing symptoms of something serious at an early stage. So it's great to send those out and look at how that can get patients back in. We talk about optimizing the value of appointments, and you made a great point. When we implemented SecureMail, we've always kind of been surprised with what clinics figure out to do with it. It's a tool that was created for sharing large files, professionally and unprofessionally, communicating with patients in a convenient and compliant way, but there's lots of different ways that people are doing it. And when SecureMail is used most effectively, some of those appointments that are lower value from a patient perspective and from a clinic perspective, could we really have done this in a different way? SecureMail is being used in that capacity to replace some appointments that might not really need to be people sitting down face to face. And when clinics do that, they're now able to focus their time the actual appointment time on more concerning issues or more impactful issues. And that's what we talk about, optimize the value of appointments. We're actually screening for patients that need to be seen, and we're seeing them because we're making room for that through secure mail. One of the ways that happens is, in Alberta, medical clinics can bill for secure mail usage if they're reaching out to patients about a concern. A patient calls in and says, hey, I have a concern about this. If it's something that can be addressed through a secure message, clinics are doing that, and they make room for that. The timing of those kind of scenarios is it takes about 2 to 3 minutes for a physician to send a patient a meaningful message versus 8 to 12 to 15 minutes of appointment time. So you can see the efficiencies there. This is what we're seeing clinics screening patients for. And what's interesting is you see stuff that's likely medical clinics, and you see some stuff, sleep conditions, grinding teeth, sensitive teeth, that dental clinics are sending out to screen their patients for. Because if you see your patients once a year or twice a year, or every couple of years, maybe, depending on the patient or your practice, you might not always be talking to them or getting answers from them about some things where they might need a little bit of extra treatment. And we kind of frame that as make sure your patients are getting all the care they need from your clinic. You don't want to leave someone hanging and have them fall through the cracks for care they may need. And like I said, patients don't always know the care they need. So this allows you to reach out to them on a regular basis or as needed. And maybe someone hasn't been in for a while. Maybe they're a chronic care patient that you haven't seen blood results for recently that you'd like to get them back in for, or you have some questions about development of a condition that you want to screen for. So there's lots of different things that clinics are screening for. COVID-19 becoming less prevalent, but still a pretty big one. We see thousands of COVID-19 screening. And Mark, you and I were talking before we hopped on here about our appointment reminder service for any medical clinics using NetAccess or PS Suite that has COVID-19 screening forms built right into it. So you can see right away if a patient should be coming in or not. So recall, we look at patient attachment, right? We're supporting the medical home here. We want to make sure that patients know who to go see and maintain that relationship. I kind of liken this to the idea of cell phone providers. I remember sitting around with some friends, and one of my friends got a phone call from their mobile cell phone provider, and the provider said, hey, we just looked at your bill and decided and figured out that you could be paying less. Isn't that great? What if clinics were reaching out to patients saying, hey, it's time for you to come in for a physical, instead of saying, let's wait for the patients to call us. And a lot of clinics are very busy, but this is a way to make sure that patients are continuing to get the care they need, maintaining that relationship with them so that they are getting care and they are maintaining that continuity. So we're not dealing with fragmented records. We're not dealing with patients going all over the place to get care, so we don't actually know necessarily what they've been doing and what they've had when they come in a year later and we see notes in their public records or Netcare or something that says, hey, this patient saw someone for this 8 months ago and you weren't aware of it. It really helps re-engage patients to make sure that they're getting the care they need and they're getting the care they need in the appropriate place. Sorry, Mark, you had a comment there.
I did. I wanted to talk about the proactivity or the proactiveness of this kind of activity to reach out to your patients, just to remind them that, to put a fine point on it, just to remind them that you're there. Because, I can only speak for myself and people that I assume are like me. And men of a certain age, like myself, tend to not go to the doctor unless something hurts. And even if something does hurt, we may go weeks or months or years without making a big fuss about it because, I just need some sleep. I need a massage. I'll get over it. And like I said earlier on, when we delay dealing with these problems, they become capital P problems. I often use the expression that I'm the kind of guy that will buy Band-Aids only when I'm actually bleeding. And that, of course, is not ideal for maintaining optimal health. And so by simply reminding a patient that you haven't seen in 6 months or 12 months or whatever the time period might be, if I receive that kind of reminder from my doctor, you should probably come in so we can talk about X, Y, and Z conditions. That proactivity is going to increase or improve my long-term outcome just by simply reminding me to go to the doctor. And it seems so simple and so self-evident, but the benefits, as you've already discussed, Jeff, are quite evident. And again, just speaking for myself as a man of a certain age, I tend not to go to the doctor unless I have to, or I get reminded that there's something that I should be dealing with, and then I will contact my doctor and go and have a chat with them.
That's an interesting point. Mark, myself as a marketer, awareness is a big thing that I think about a lot. And what we see on a regular basis, I know Mark, you and I talk about this. We talk about this at Brightsquid, and we've talked about this on these user groups before. From a medical perspective, there are, we'll call them threats to the continuity of care who are reaching out to patients on a regular basis in the form of private virtual care. So we, like I said, we have Sun Life insurance, and that gives us access to Lumino Health and a couple of other programs. And they email me on a regular basis, not always encouraging me to get care, but sometimes they're reaching out to say something like, hey, how's your diet? Or did you start drinking too much during COVID? Some sort of health related message that reminds them or reminds me or recipients of that message that Lumino Health is there to help you, support you through your healthcare journey and support regular health. This is something that every healthcare clinic could be doing. And the risk that we see is that patients starting to dilute the care, getting care in different places, taking advantage of these services that are often free through work. They're not receiving the continuity of care that we all know is most beneficial for public health. And also, it makes it in some cases, certainly in rural settings, smaller areas, it makes it less sustainable for clinics if some of their patients are getting siphoned off to go to where they're getting more attention, potentially from other services. So that's something else to keep in mind with just reaching out. Sometimes a recall isn't just about getting the patient back in. It's just about reaching out to them with a reminder that you're here thinking about their health too, and you've got their best interest at heart. So that's what we see some clinics starting to do now in the face of these things like Maple and Lumino and a few of the others that are out there in the market talking to patients.
Yeah, and Jeff, just to add on to that, over the last 2 years, we've seen a supercharging in patients' desire for remote communication with everyone. I mean, I have elderly aunts and uncles that never, you couldn't imagine them ever using a Zoom call to have a conversation. But as soon as the pandemic started, everyone was jumping on these video conferences and talking to their friends, their relatives, and their doctors.
Yeah.
And a certain portion of the community really likes that kind of conversation. And it's what we might call a digital transformation. And COVID-19, for all of its negatives, has been very positive in getting people involved in more digital communication, and they want to continue to do that. And everyone on this conversation, on this call today, that's using Secure Mail is part of that vanguard of the digital transformation of communicating with patients in a way that maybe you wouldn't have dreamt of 2 or 3 years ago. Now it's just standard practice.
Yeah, and you're right. And every article I read on a daily or weekly basis is patients expect this to keep going and to only increase. And that's what we see. I mean, now there's almost 250,000 patients in Alberta that have a Secure Mail account alone. Recall conditions. Hey, the doctor would like to see you for a physical. You're a diabetic and we haven't seen you for a while. Colorectal screening, right? Something you want to bring them back in for to get them done. If it's not just a questionnaire you could send out. Imaging, dental clinics. Hey, we don't have up-to-date images of your teeth. We'd like to do that because we want to make sure that there's no cavities developing. That sort of thing, sending those messages out can help build a relationship and get patients back in for the care they need, as well as fill any gaps in your schedule that might have popped up since people have started avoiding care, or other sort of no-shows, that sort of thing. Referral reviews. We sent you for this referral. You had this care. This is the note we received back from the doctor. let us know if you'd like to discuss, or we'd like to discuss this with you. Same thing with results. Anything that pops up, hey, we sent you for this lab review. We'd like to get you back in for that. That sort of thing is what we have been seeing for several months now.
Let's not forget that secure mail is a two-way street. So anything that you send to your patient can elicit a reply. So, hey, fill in this document about your recent eating habits or drinking habits, or if you started smoking, let us know. Collecting that kind of information, even in advance or in addition to an in-person or a virtual appointment, all builds to that profile and that medical home that you talked about earlier, Jeff.
Yeah, great. And what we see from the evidence, again, is that higher rates of preventative screening are associated with lower rates of emergency visits and hospitalization, as well as greater patient satisfaction, which is, as we all know, is one of the main quadruple aims there. And that's from the College of Family Physicians of Canada. Now, I want to talk about a program that we've been collaborating with a couple different clinics and some other partners. And this is specific to increasing rates of HPV vaccination. Last year we all saw that there's vaccines for HPV that do a really good job of preventing some very bad cancers that are related to HPV. So we wanted to see how we could improve vaccination rates in some of the populations that normally maybe wouldn't but should get the vaccine. So just to go quickly through this from a numbers perspective, and then Mark, you can talk maybe a little bit about how this worked. About 1,300 patients were put into this screening program. They were sent messages through secure mail as well as text message that took them to a link of a secure landing page. So the messages didn't say anything about HPV. What they said was, hey, we have some important information about your future health that we would like to discuss with you. So nothing private or personal or protected in the invitation messages, but then they could log in with their date of birth to a secure landing page where they could see some information about HPV, the vaccinations, and fill out a questionnaire that the clinics could use to assess the appropriateness of the vaccine for them. And what was really interesting is when we did that, over 12% of these patients did book an appointment to have a consultation. 30% of them completed the screening questionnaire, which was a little bit beyond our wildest dreams, to be honest. What was really interesting about that is now the 30% of people, the 30% of patients that filled out that questionnaire, now there's extra data about them that can be added to the record. And even if they didn't book a consultation appointment, there might be something else in there that the clinic might decide or the doctor might decide is something that should be followed up on, and you can reach out to them and say, hey, you didn't ask for an appointment about that, but we'd actually kind of like to talk to you about this now. The way that this was done, it wasn't all at once, because imagine getting 170 appointment requests in one day. That would be overwhelming. This was actually done over a series of months with a few messages being sent per week, maybe a couple hundred per week kind of thing, slower at first, and then we kind of ramped up. And this rate actually increased. It was about 10% booking consultations at the beginning, kind of went up to 12%. And there's some things we did around that. But Mark, you want to talk a little bit about how the program worked messaging wise and what the clinic saw on their end?
Yeah, absolutely. So, I mean, you already talked about the basics of how it worked. So, as you said, messages went out to patients via email or SMS text message, if I recall correctly. And they got a personalized message. So it was like, "Dear Mark, your doctor, Dr. Jones, has an important message for you they'd like you to review." That was all. That, of course, was all custom written by the clinic themselves. So it's not a boilerplate message. They actually were able to send a very customized message to their patients. And then the patients would be notified a couple of times if they acted on the message right away. Of course, we didn't remind them if they already did the thing we asked them to do. But if they, ignored or didn't act on the first message, we'd remind them again in a couple of days. Meanwhile, on the clinic side, the MOAs at the clinic have a very clear dashboard showing kind of what you're seeing here on this slide, letting them know where everyone is in the process. So for those patients that had submitted their questionnaire back to the clinic and or requested an appointment, the MOAs had a list I think it updated every few minutes, showing them anyone else who had requested an appointment. So the idea was, as soon as someone requested an appointment, an MOA would be able to act on that either right away or within a few hours anyway, and get that appointment booked and get the consultation started so that they could begin the process of administering the vaccination. So it was a very smooth process on both sides. And to Jeff's point, we didn't just bulk message 1,300 people all at once and say, hey, you should know this. It was done for individual doctors within the clinic. The messages were sent out in a very structured format so that we weren't getting 170 appointment requests all at once. This was over a few days or a few weeks, as I recall. So it's an interesting way to look at the kind of recall and screening that we've been talking about earlier, to ensure that patients are getting whatever treatment might be appropriate for the demographic that they belong to. Based on their age, their pre-existing conditions, where they live. There's all kinds of different parameters that can all be, customized for the different types of screening programs that might be helpful and relevant for your practice.
Yeah, and it's a great point. What was really neat about this system, and we'll talk about it in a second here more, is that if a patient didn't open a message, they could be re-engaged. So, and that persists. So in a month, if there's some extra time in the clinic, you might look back into that and see, oh, there's 20 patients that didn't open the message or didn't respond to anything. Let's resend that to them and see if we can get them back in for that screening because it's important. So really kind of useful tool that kind of sits there and something that MOAs or staff or clinic management can address at any time. So we've got a couple questions. I will point out right now, people are doing it manually. The program we talked about is sort of a precursor to a bulk messaging service. So you'll be able to do, like Mark said, identify a group of patients, get them in the system, send them some defined messages, and address any kind of screening or recall through that. If you'd like to get access to that service, email Mark. There's his email address. Feel free to spread that all over the internet. Mark doesn't get enough email. We do have a couple questions I want to get to, and one of them I think we kind of answered, but how do clinics manage the extra work of engaging more patients in this way? Mark, do you want to talk about that? We kind of talked about it already, but the sort of...
Well, yeah, there's one, I do get asked that question even on the phone while I'm talking to individual clinics is, this feels like a lot more work to do this kinds of screening programs. I always turn that around and say, well, aren't you already doing these things just in a different, more awkward way? And by different and awkward, I mean phone calls. Clinics are already calling their patients to remind them that they should come in or suggest that they come in for a specific vaccination, and they're doing it in ways that are just inefficient. Some clinics, maybe people on this call, are doing these sorts of things already through their regular secure mail messages, which we can now hopefully start doing. Well, not hopefully, we'll certainly be able to start doing that through bulk messaging. So rather than sending a message to one patient at a time, or 2 or 3, why not send that same message to 100 patients at once? And those sorts of time efficiencies really multiply over time when you find more convenient ways to do the jobs that you're already doing. So it's not necessarily doing more work, it's doing the same work, but faster and more efficiently.
Well, and to add to that, not all clinics are doing this outreach because they simply don't have time. And it's work
Correct.
that everybody that I've spoken with, and I know you've echoed that sentiment, people express the need to do it. This is all stuff that is recognized as appropriate and needed and necessary work, but it's one of those things that comes back to who has the time. Like you said, calling patients to do this is so time consuming that it can be overwhelming, and it's work that often doesn't get started. And this tool is something that we've built at the request of many clinics, for years. I remember going to a conference 5 years ago and having a doctor ask me, do you do bulk messaging? Because I really need that. And here we are. We've got it ready to go. So yeah, it's not about creating extra work. It's about doing work more effectively and efficiently. And like I said, there's ways to find room for any new appointments if you think you're at capacity. We've seen clinics increase their capacity using secure mail effectively by 20 to 50%, which is really interesting for a lot of clinics to hear. Now, next question is, what do we do if patients don't respond, Mark?
I think you talked about that already. Was that there's a retargeting opportunity whereby if the patients don't respond to the first message, we can send them a second one or a third one, and if after a certain number of tries, it's still not getting the desired response, at that point, maybe that's when you change the channel and go back to maybe something that the patient's more familiar, more comfortable with, which may be a phone call, and that's fine. I mean, we saw in those results you were showing for the HPV vaccination program that we didn't get 100% success rate. I mean, we didn't get 1,200 patients or 1,300 patients looking to book a consultation. We got about 10%, and that's a good number of folks to get back to any program. So try the different channels, find out what works best for your particular patient population, and then continue down that path and get the responses you're looking for.
Great. Yeah. One final question I have here, Mark, is can the bulk messaging system deliver attachments?
Yes. So the bulk messaging can deliver messages through regular email. So we can just send like for example, a public service announcement that's not necessarily patient or healthcare related. Like we're going to be closed for Christmas holidays from December X to January Y. Uh, in addition to that, there's a secure component, as with a regular secure mail message, that includes all the same stuff we're used to with regular secure mail. And that includes attachments as well as personalized information that may be sensitive to the recipient. So something about their condition is most common. So the short answer I should have said is yes.
Yeah, but obviously, if you're sending bulk messages out to a bunch of different recipients at once, the attachment would have to be generalized. It's not something you would use to send a lab recs, for example, because those are specific to one patient at a time.
Yeah. But it might be an important piece of educational material about managing your diabetes or other healthcare condition, which
Absolutely
is considered healthcare information, even though you're sending it to 100 people at once who all have that same condition. And to be clear, the other 99 people don't know about everyone else on the message. It doesn't look like a mass message with a whole bunch of addressees at the top.
Exactly. Yeah, that's a good point. And even something like that, like the diabetes approach, hey, there's new information out, or maybe you just want to engage your patients of a certain chronic disease on a regular basis every 3 months or something. Send out, maybe it's a newsletter, which sounds like maybe too much work, but some update about what's happening now with your health, or some reminder that you want people to keep track of. So that brings us about to our time today. Thanks very much, Mark, for your input on this. Thanks again for tuning in today, and we'll be back at the end of May with some more great insights. Thanks, Mark.
Thanks, everyone. Have a great afternoon.